In this episode, Kate Woods interviews Dr. Jessica Miller on using functional medicine to address illness by focusing not just on the root cause, but on lifestyle changes. We're going to discuss what is functional medicine? Does insurance actually cover functional medicine? What kind of metrics do you use in functional medicine? How do employer-based insurance models impact the use and payment of functional medicine? How does functional medicine educate? What about the use of weight loss drugs? Can we actually rebuild microbiomes? Functional medicine for women? Why avoid processed foods for kids? How common is gout? Let's discuss the mass production of harmful foods. And finally, adapting to an actually healthy lifestyle. Again, our guest is Dr. Jessica Miller. She's the founder and medical director at Fusion Integrative and Functional Medicine. Let's get into it.
What functional medicine is and how it differs from maybe how they view traditional Western medicine.
Really, the way I approach functional medicine is to look for root causes of illness and disease. Normally in traditional medicine, the way we were trained is to kind of put Band-Aids and treat symptoms. And so, if you have high blood pressure, you'll get a high blood pressure medication. If you have high cholesterol, you get medications for cholesterol. And so what functional medicine does is try to look for sources or reasons why you could have high blood pressure. For example, if you have the wrong bacteria in your mouth, or if you have the wrong bacteria in your gut, or if you're low on vitamin D, or many other causes as well. But essentially, it's about living healthier and changing pretty much diet, lifestyle, and intervening to try to bring wellness and health rather than disease or dis-ease, I would say.
Love to hear your thoughts on where insurance comes into the mix, how it works with functional medicine practice, and why do you think maybe the industry isn't adopting it as a concept more?
Unfortunately, functional medicine is often not insurance-based. And the reason for that is when I meet with a patient, I can spend an hour and a half or more with that patient. And then after I see them, it still takes me 2 or 3 hours sometimes to put together their plan, in addition to the time that I prepare before I see them. So each individual interaction could be up to 5 hours. And so the problem with that is that in order to be reimbursed for that amount of time, insurance companies often won't pay for that amount of time. So a lot of times it winds up being an out-of-pocket expense. So the point is that insurance companies, really look for outcomes, and they want you to be quick, and they base things on RVUs and volume and things of that nature. And functional medicine is not a volume medicine or a volume type of, treatment. The other thing is a lot of the interventions that we make in functional medicine, unfortunately and fortunately, are often rather inexpensive and don't always require medications. And there's no money behind that as far as reimbursement for pharmaceutical companies and for other things. And so insurance is a financially driven industry, for lack of a better word, and functional medicine doesn't fit into their model, I would say. I have to fight with insurance companies often for massage treatment or lymphatic treatment and physical therapy. All of those things are very, very limited. But when you look at the cost of a few sessions of physical therapy versus the cost of a medication, which could be $10,000 per injection, it should make sense that insurance would cover it, but they generally do not.
Yeah, because you can't measure it, right? So maybe
there's
a
lot
little
of
bit of
outcomes that are not right. Exactly.
Yeah.
There's metrics in medicine. We have a lot of metrics and RVU targets and outcomes that we have to meet, and we don't measure them the same way in functional medicine. I trained in physical medicine and rehabilitation. So I've worked in rehabilitation hospitals,
Yeah.
I've worked inpatient and outpatient. So I'm aware of all of those metrics that we always, had to jump through hoops to meet.
Yeah. So if you're sick and I cure you or correct your symptoms, I can show here was the disease state and now it
Yes,
is different. And it's almost, I feel you a little bit in my profession as an attorney and a compliance professional. It's like, what's the best value of the job? It's preventing bad things from happening. How do you
right.
measure that intangible? Over the
It's
long term, it can be measured. Longer life
right.
expectancies, less
Less
people,
hospitalizations, less
yeah.
medication utilizations. Yeah, absolutely. Less sick days at work, less missed,
Yeah.
opportunities. But those are not things that, to my knowledge, those are not things that are metrics that are measured often.
Yeah. How do you think the employer-based insurance model impacts that? Because if Mr. Smith works at employer X and they use our plan, that person's our member. If he
Right.
gets another job, he's not. So his long-term benefits might be good for society or the total bottom line, but not necessarily for
The
employer
insurance
A or
company.
the
Right.
insurance company.
I think that one of the biggest issues oftentimes is that health and wellness, when somebody's healthy, they don't require a long-term medication. And which is a great thing, you would think, but when you look at the biggest blockbuster medications that are around, those are medicines that people need for the rest of their lives, right? It's almost like in the United States, we're not interested in people staying healthy. We're interested in them being just a little bit sick. So they need
Mm.
medications for lifelong. And, that sounds kind of sinister. And I don't love the way that that sounds, but I worry sometimes that there's some potentially other factors at play that drive health and wellness. One of the things that I think is super important, and I don't know if this exactly relates to your question, but when we look at the foods that are available for us to eat, they're not very healthy. Um, and a lot of the money that we spend on medications to treat our food, we
Yeah.
could put into the food industry and have better, healthier, real food, which wouldn't make people sick in the first place.
Yeah, which feels like we did at some point well before you and I came into this world, Jessica,
Right,
right? But we didn't always have just like processed cellophane packaged food for lunch.
right, right. And I think, and that's one of the things that I often work with patients on, because there's so much going on behind the scenes that you don't even realize that you're doing in your day-to-day life, which can be making you sick, and causing problems with hormones and infertility and headaches and skin issues and all of these really common manifestations of disease. And a lot of them can be tied directly back to diet and what you're putting on your skin and which pesticides are on your foods and what you're spraying and cleaning your house with, and all kinds of really basic but ubiquitous chemicals that are everywhere.
So basically, a piece of it is like fundamental lifestyle changes.
Yes, yes. To be honest, I would say a lot of what I do in functional medicine is really more education. I work with the patient to meet them where they are and educate them to make changes that are beneficial for their health, and try to open their eyes. And every patient that comes into my office, I'll say to them, I don't get you better, you get you better. I just kind of give you a roadmap of what direction to follow. But
Yeah.
ultimately, the changes and the decisions you make are up to you.
Yeah. Do you see, I mean, I'll speak for myself, a woman of a certain age, it takes me multiple attempts sometimes to change a behavior.
One of the things that we often do, or I often recommend in functional medicine, is actually health coaching.
Mhm.
I find that a lot of patients do very well with health coaching because I can put together the plan, right? I can look at all of their medical issues and see where is the low hanging fruit that I think we should change in order to get you healthier. But at the end of the day, you're the one that has to make the changes.
What's a typical lifespan of a lifestyle behavioral change like that for a typical patient, on average? Does it take a year, 6 months for those who are successful at it?
To be honest, it depends on the person. You need to really do something pretty consistently. And I know this is going to sound crazy, but for foods, for example, to change your palate, to like a taste of something that you never liked before, generally about 2 weeks or so, or 10 to 14 times of trying the food in order for your palate to really kind of get used to it. But it depends on the patient, and it depends on the degree of resistance that they have.
The whole craze with Wegovy and Ozempic and these long-term, and I think for me, on some level, they're wonderful because people who haven't been able to lose weight for a
Right.
really long time are able to do it. It can be a kickstart.
Mm-hmm.
But it also seems like a really bad idea to be on a medication for the rest of your life.
And I have seen patients who have tried everything and can't make any dent in their weight or their metabolic syndrome, no matter what they do, have remarkable improvement from these medications. So I don't say this lightly, but I do believe that they are very helpful in the right population. What I would say is, again, is that we're using these medicines to treat our lifestyle choices. And they're not always the choices that we make, but kind of what the food industry has made for us. And so part of the problem is, or my belief anyway, there's a lot of foods that are addictive purposely. And those foods actually hijack our cell signaling systems. And so when you have the wrong bacteria in the gut that are helpful with production of GLP-1, you don't ever feel full. Because of all of those changes in our microbiome in our gut, in the pesticides in our food, in the forever chemicals that are in our pans that we are cooking with, we are putting thousands or millions of nanoparticles of plastics in our bodies every day. And those particles interfere with hormone signaling or peptide signaling. And so the result is now everybody is on the GLP-1s because we have decimated our body's ability to create these peptides or signaling molecules or to respond to them because we've ruined our receptors or other things. We no longer have the bacteria which help to make the GLP-1s. So, but that all being said, I do believe the medication is helpful to reset the body. There is evidence, peptides have been around for many years, and peptides are signaling molecules just like hormones.
Yeah. So you mentioned something like we've destroyed our microbiomes. Can we really fix them? Like do probiotics work? If I go to, the health food store and I buy a bottle of probiotics, does that work? How should we think about probiotics and prebiotics?
What I believe to be true is that one of the big problems is a lot of people have irritable bowel and ulcerative colitis. And so when that happens, they get more blood in the stool and in the colon, in the lower GI tract, which brings oxygen into the lower colon and to the lower GI tract. And a lot of the bacteria that are supposed to live there are anaerobic or obligate anaerobes, which means they don't really survive very well in the presence of oxygen. So when we've raised the oxygen tension in the GI tract, and then you try to put in new probiotics, they'll never survive because essentially you're trying to repopulate the GI tract in an inhospitable environment. So a lot of times you need to kind of go back and heal the gut lining first before you can add back in probiotics. I'm not sure that you can fully change your microbiome by just taking a probiotic for a month and then say, great, I'm good. It's really more about what you're eating every single day.
You're really seeing a lot of focus on women, middle-aged and older. Really, we have just more disposable income now, all kinds of reasons. Like we're looking at our health more. The industry is really developing. And I feel like as a woman and as a wife and mother, we don't tend to take care of ourselves. And now I
Right.
think we are seeing this, and you're seeing kind of industry and marketing respond to it. Where does where do you think functional medicine fits in that for, for women who we have so many changes that I feel people have ignored?
So, number one is to work on the sympathetic and parasympathetic nervous system, and to balance out the stress response. So, that's either through something called dynamic neural retraining, which is rewiring the nervous system to have a decreased stress response. So, that would be the first thing. And other ways that you can do that are meditation, breathing exercises. There's a device that my patients use I love. It's called a Sensate. And there's also other vagal nerve stimulators, which actually activate the vagus nerve, which shut off the sympathetic nervous system for somebody who can't get out of their own head. You're too overwhelmed to
Yeah.
take a deep breath or to try to talk yourself out of it. And so that's one way. Humming, deep breathing exercises, I think I already said. Biting on a pencil is another way. And actually splashing the face in ice cold water, the nose and the mouth, will activate the diving reflex. Laughter is another one. So number one would be activating the parasympathetic nervous system. And I think that's the most important thing, because what happens is with everything, that affects everything else. So that would be number one. Number two, in a woman of our age, I think it's really important right now to start the day off with a lot of protein. They aim for like 30 grams of protein in the morning, and make sure that you're getting enough protein throughout the day. There's a range of that, but 1 to 1.5 grams per kilogram is where they say, generally speaking, sometimes more, depending on the person, because that's super important. I think the next thing I would say is exercise. The reason is because exercise has so many beneficial effects. Walking is great, but at the end of the day, you want to oxygenate your tissues. Anything that you can do to bring blood flow and oxygen to your tissues helps with repair and helps with removal of all of the kind of garbage that builds up inside the cells. So it's like you don't want to wait for 2 weeks to take out the trash because it rots. So movement is super important. That would be the second thing. And then the third thing I would say is obviously is trying to focus on foods which balance hormones. So things like polyphenols, like pomegranate seeds or flax seed, olive oil is another one, avocado is another one, ginger is a great option, cinnamon. So one of the other things that I try to tell my patients are to eat a rainbow, not Skittles, but a rainbow, and try to use a lot more herbs and spices, because a lot of the herbs and spices on the food are antibacterial and antiviral and anti-inflammatory. And so really that's one kind of big thing you can do is go into your spice cabinet and use your spices.
Yeah, no, and the company is not going to change if everyone's going and buying the Fruit Loops.
100%. You have to, hit them where it hurts and stay with their, if they don't sell their product, then they'll change it. But otherwise, why would they? The problem is that we have children start their day off with sugar cereals, and they have huge amounts of carbohydrates, which set up the entire day to be this roller coaster of insulin and glucose and unstable blood sugars. The other thing is that we have so much high fructose corn syrup in everything where it doesn't need to be. I mean, if you look at ketchup, the first ingredient is tomatoes, but the second two ingredients, unless it's organic ketchup, is corn syrup and then high fructose corn syrup, or vice versa. But the truth of the matter is that if corn syrup and high fructose corn syrup are almost the same thing, the only reason that they split it apart in my mind is because otherwise it would be ahead of tomatoes in the ingredient list, right? Because it would be the highest concentration.
Sugar. You're eating sugar.
Well, fructose is worse than sugar, actually. Fructose, I don't want to say worse than, but fructose has its own set of issues. Issues. The problem is that fructose can only be broken down in the liver, whereas glucose can be broken down in every cell in the body or utilized.
Okay.
Fructose can only be broken down in the liver. And therefore, when you are eating huge amounts of fructose, then the liver gets overwhelmed. And when the liver is overwhelmed by fructose, what it will do is take the excess fructose and convert it into fat. So the reason that everybody is developing fatty liver is in children and everybody else, which directly correlates, by the way, with metabolic syndrome, is because of the fructose that we are eating and the huge amounts of it that's in everything. And we should really be eating under 25 grams of fructose per day.
And gout's funny, because I've heard it more now in the past couple of years than I ever heard it my entire life. Like people saying, I have gout. My doctor told me I have gout. And I thought, most of the time I heard the word gout, it was because I was reading, a history book about,
Right.
Queen Elizabeth and her court.
Right.
I'm like, gout? Who has gout in the 21st century?
And it's so common.
Yeah.
I mean, there's a genetic issue with xanthine oxidase and with some other things that can happen in a subset of people. But nowadays, it's rampant because of the amount of fructose. And the problem is that uric acid, which is the byproduct of xanthine oxidase, actually tells the body that we are in a fed state, but it tells the body to store fat. It's actually a trigger that tells the body to store fat. So the higher uric acid levels that you have, the more you're likely to have metabolic syndrome.
Our society figured out how to mass produce certain things, and you said it earlier, which had an initial good idea behind it. We're trying to feed as many people as possible, as cost effectively as possible. It's like amazing. But
the side effect was unintended and negative.
Yeah, I can have a jelly donut now every day instead of, my grandparents probably had a jelly donut 3 times a year on a very special occasion or something like that,
Right. The truth of the matter is that I'm not perfect either, and I don't profess to be, and I don't expect my patients to be, because there's too many temptations in society, and it's not about depriving yourself, but it's more about making good choices. And so I'm not going to say that I'm 100% gluten-free or 100% dairy-free or 100% sugar-free, because I'm not.
And honestly, I think that's probably the only way we're going to have adoption around it, because I could say I'll never be perfect. There's not. I know a few people who are perfect. I don't happen to be one of them. And I go,
I'm not either.
I don't know if I could ever give up.
I think enjoy. Enjoy, as long as you understand the consequences of what you're doing and you can make the educated decision, then I think, go for it. And like I said before, it's really more about understanding and learning because some of the things that you're doing, you don't even realize that they're having a negative effect on you. And they're simple swaps.
Dr. Miller, thank you so much for your time. I always learn something whenever I talk to you.
No, thank you so much. I really appreciate it. I hope that I answered the questions appropriately.